What are the chances of pregnancy after sterilization? Sterilization is often chosen as a permanent way to prevent pregnancy, but it's important to know that it's not 100% foolproof. While it's highly effective, there's still a small chance that pregnancy can occur after the procedure. The most common type of sterilization is tubal ligation, sometimes called having your tubes tied. Research shows that within the first year after tubal sterilization, about 2.9% of women may still become pregnant. This risk increases over time, and after about 10 years, the chance rises to roughly 8.4%. The likelihood of pregnancy after sterilization also depends on age. Women under 35 tend to have a higher chance of pregnancy after the procedure compared to women over 35. In fact, pregnancies after sterilization are very rare or almost non-existent in women over 35. The type of sterilization method used can also influence the risk. For example, clip sterilization might have a slightly higher chance of failure over 10 years compared to methods that involve coagulation or burning of the tubes. Pregnancy after sterilization can happen if tiny gaps develop in the tubes or if the blockage isn't complete. Sometimes, the tubes may heal or reconnect over time, allowing sperm to reach an egg again. It's also worth noting that sterilization does not protect against sexually transmitted infections. So, even if someone has had their tubes tied, they should still consider using barrier methods like condoms to reduce the risk of infections. Compared to other forms of contraception like implants or intrauterine devices, sterilization has a very high success rate but is slightly more likely to fail. Implants and intrauterine devices have less than a 1% chance of pregnancy within the first year of use and are effective for many years. In summary, sterilization is a very reliable form of birth control, but it's not completely foolproof. The risk of pregnancy is small but exists, especially over many years and in younger women. Anyone considering sterilization should discuss these risks thoroughly with their healthcare provider. Remember, sterilization does not prevent sexually transmitted infections, so additional protection may be necessary depending on individual circumstances. Always seek personalized advice from a medical professional to understand what's best for your reproductive health.